my name's Angela Rogers, and I'm going to be performing a functional movement screen with my client Heather here. And we're going to be performing a variety of movements, and I hope you enjoy it. So the first one we're going to be doing today is the deep squat. So I'm going to have Heather here. She's going to stand in a neutral position, head forward, chest forward. She's going to make sure her legs are shoulder length. She's going to place the dowel fully above her head, maximally keeping her arms straight, 90-degree angle here. And I'm going to have her lower down into her first squat, and she's going to do 2 repetitions, and I'm going to score her between 0 and 3. Whenever you're ready, slowly. Good. Back up. And one more. Good. So she went below her knees, which is actually about a 2, and 2 is average for this scoring process for the functional movement screen. So that's a great score. We'll go ahead and score her with a 2. So the next one we're going to do is the hurdle step. So right now this is to test her torso and her the strength in her balance. Right now what we're going to be doing is having her do 2 repetitions each leg, and she has the dowel in a neutral position behind her shoulders below the neck. And what I'm going to have her do is maintaining the stance of the opposite leg. She's going to lift one leg up and slowly hurdle herself over over the string here. So go ahead, and when you're ready, we're going to perform the first rep. Okay, go back. We're going to have her go a little bit slower this time. Good. Okay, we're going to go ahead and switch legs. So whenever you're ready, you can take a breather. Good. And one more time. Good. So I see that she does have a little bit of instability in her torso, and her foot does pop out a little bit. So if I was going to score this, I'd give it a 1, but that would be something that we would work on, and then hopefully her torso gets strengthened up. So the next one we're going to do is called the inline lunge. What this tests is lower body strength and balance. So right now I have Heather firmly grasping the dowel. It's touching her head, her neck, and her sacral region. We have 1 foot forward, and the length in between both of her feet is the length of her tibia, so we know that the measurements are accurate. And what I'm going to have her do is slowly lower herself into a lunge. We're going to do that twice for both legs. And then I'm going to go ahead and score her after seeing what her lower body does. So go ahead and slowly lunge down. And back up. She's keeping the dowel firmly pressed against her back. One more time. And up. Good. And then we're going to go ahead and lunge with her left leg next. So I'm going to have, she switched legs, so I'm going to go ahead and have her slowly lunge down with the opposite leg. Seeing if there's any instability. And one more time for me. And back up. Good. So I saw she was a little wobbly with her balance, but I would score this at about a 2, which is average, and then see if there's any improvement. So the next one we're going to do is a shoulder mobility. This is going to test her shoulder range of motion. So the first thing I'm going to have her do is I'm going to have her adduct her right shoulder and reach it overhead, making a fist with thumb inside her hand. And she's going to reach back with her other arm and externally rotate it. And I'm going to go ahead and measure the distance between these 2. So the 2 closest bony proximities are here and here, which looks at about 8 inches. So we're going to go ahead and take a rest, and we're going to switch arms. She maintains a fist. So the 2 closest bony proximities are here and here, which looks at about 8 inches as well. So roughly 8 inches. And the size of her hand, let me see the size of your hand. So from her wrist to the longest portion of her middle finger is roughly 6.5 inches. So that's a pretty good test that she reaches just close enough the distance of her hand. So if I was going to score this, I'd score it at about a 1 or 2. So this is the shoulder clearing test. This is actually a non-scored part of the exam. Usually takes place right after the shoulder mobility test, solely to observe pain. So we're going to go ahead and start with one shoulder. She's going to place one hand on the opposite shoulder and attempt to raise up her elbow. Do you feel any pain associated with that? Okay. And then let's do the other arm. Okay. And research says that this test should actually be performed bilaterally, so we're just gonna do it bilaterally just to make sure that there's no pain associated. Her arms move perfectly fine. Okay, that's the shoulder clearing test.
Great.
So this is the active straight leg raise. So right now I have Heather lined and laying down supine. She's gonna keep her ankle dorsiflexed. And when I tell her, she's gonna lift up one of her legs and we're gonna measure to see if it goes past the dowel, which is placed in between her patella and her iliac bone. This is to test the strength in her torso and isolate the hip from the spine. So when you're ready, you can go ahead and lift up one leg, keeping your legs straight and your ankle dorsiflexed. All right, good. We're gonna do it one more time. Good. Take a breather. And then we're gonna go ahead and switch sides. So whenever you're ready, you can do the next leg. Up, almost. And one more time. And good. So her feet didn't quite make it past the dowel. So if I was gonna score this, it would be at a 1. And then we would go ahead and do some core exercises to strengthen her trunk. So this next test is the trunk stability push-up test. This is just measuring upper body strength and trunk stability. Right now I have Heather, she's gonna be laying prone with her hands shoulder width apart. And then she's gonna go ahead and make sure that her body is lifted as a unit. So she's gonna be performing one push-up and making sure without any lag. So pushing up all in one, she's gonna come up and perform a push-up, and that's gonna determine her trunk stability. So whenever you're ready, go ahead and lift up. Okay, go down, up, one more time, and good. Go ahead and rest. And if I was gonna score this, I'd score it at a 2, which is average for her trunk stability, so that's a great score. So she just finished the trunk stability push-up test, and immediately after, we're gonna go ahead and clear it. So this is the trunk stability clearing test. So right now, she's not gonna be performing a push-up anymore. She's actually gonna just be lifting up her trunk, solely isolating the lower half of her body. And I'm gonna see if she has any pain right here and where her trunk is. If she does, then this test would be scored as 0, and she would have to get physician clearance to keep going. So go ahead and lift up slowly whenever you're ready. Keep your head towards the sky. Do you have any pain associated?
No.
Nope, okay. She can go ahead and lay back down. She has no pain, so that means she's cleared. So the last test we're gonna be doing is the rotary stability test. This tests the coordination and the neuromuscular junction between the upper and lower extremities of the body. So this is a pretty dynamic movement, it's pretty difficult. So what Heather's gonna be doing is right now she's in a neutral position. She's gonna be raising one leg up and on the same side, also her shoulder, and she's gonna be bringing them in towards each other where her elbow touches her knee. So when you're ready, Heather, we're gonna start with your right side. We're gonna do 2 repetitions. Go ahead and bring your right leg up. Almost. And bring it in. Good. Take a break. And try one more time. Good. Okay, we're gonna go ahead and do the left side now. Good. And one more time. And good. So if I was to score this, it would be about a 1, only because she does have a little bit of instability in her trunk when she's raising both limbs up. But again, it's a very difficult exercise. We're gonna go ahead and clear it really quick to make sure she doesn't have any pain. So I'm gonna slowly have you lay back, put your head down. Do you have any pain in your spine back here?
No.
Nope. So she is painless, therefore she is going to be clear, and that's the rotary stability test.